prior authorization. What is that? And why am I bringing this up, especially with Medicare? If you're on original Medicare with a Medigap plan, you're definitely going to want to listen to this episode where I bring in Sean Southard, who is our Medicare expert, who's going to talk you through prior authorization and what's happening brand new in the Medicare space. We hope you've been enjoying all the episodes from the Secure Your Retirement podcast. If you'd like to keep learning and receiving these episodes, then hit the subscribe button and turn on notifications by hitting the bell so you receive alerts when each episode comes out. We've helped thousands of listeners get on the path to securing their retirement. Now it's your turn. Let's dive in. Welcome back to the Secure Your Retirement show. And thanks again for joining us. The goal of this show is to bring value in a lot of different areas around financial planning topics, investments, taxation, and really everything that we come across in our firm, questions that we get from clients, questions that we get from people that have been listening to us for a while. We just try to make this podcast as educational as possible and deliver as much value as we can. And one of the bigger topics that we do bring on from time to time is Medicare. Medicare is a very, I would say, difficult topic, constantly changing topic, and there's a lot of things that you need to know, especially as you're entering into Medicare, making the right decisions up front, but then also kind of understanding how it's going to impact your life throughout the years, especially as we do have some significant changes around policy and structure. And while that in itself is a mouthful, it's a lot to keep up with. And so for that reason, in our firm, I'm sure you guys, if you've been listening to us for a while, you know who Sean Southard is in our office. He is our health insurance professional. He helps people if they retire early before Medicare to think through what private insurance and pre-Medicare insurance is going to look like for them. But as they start transitioning to Medicare, he helps in a very consultative manner to help them kind of think through what's going to be best for them based off of the lives that they live and what type of help they're going to need on the medical side. And so Sean's got a really great topic for us today. So before we dive in, I just want to say, Sean, thanks. I know right now it's always a busy time for you. You're constantly on the phone, talking with clients, meeting with clients, helping them think through these decisions. So thanks for carving out some time today for us.
Oh, you're welcome, Urs. It's always great to be here. And I know when we talk about Medicare, you always get really giddy. So I always enjoy the giddy MERS. So
Yeah.
pleasure to be here.
Well, it's one nice thing that I don't have to keep up with Medicare as much as I used to, and a big reason of that is we brought Sean in a few years ago to just really take on that role of being that Medicare expert. And so we really appreciate having him in the firm, and I know our clients do too. So on to the topic for today. It's around prior authorization. Now, if you don't know what prior authorization is, Sean's going to explain that throughout the episode. But is it coming to original Medicare, and what do we need to know here in 2026? If you've been on original Medicare and have a Medigap plan, this may potentially impact you. And that's why Sean brought this topic to me, and he said, hey, I think this one is a little bit niche and a lot of people it may not impact, but I think if things are headed the way they are, it could be something that everyone should be aware of. And so that's the whole driving reason to spending about 20 minutes on this podcast today, walking through what's going on in Sean's brain. There's always a lot of things going on in Sean's brain. But when it comes to Medicare, he said, I think people really need to understand this and know about this. So Sean, thanks again. Anything you want to add before we dive in?
I just to kind of reiterate what you said, MERS, I think this is a niche topic, and even though it's not going to impact everybody at this point in time, I do believe the writing on the wall, where the powers that be are taking this, I do believe it's going to get expanded, and it's going to eventually impact everybody in Medicare. So that's why I really want to spend some time on it today.
Okay, well, great. So let's just jump right into it then. So what's actually happening? What do you see that's what is changing?
Yeah, so basically, starting here in this year, 2026, Medicare is launching a new pilot program in 6 specific states that's going to include, it's introducing prior authorization for certain procedures under original Medicare. Because right now, in the original Medicare, there really isn't prior authorization for these procedures, but they're going to pilot a program in 6 states that's going to introduce this into the mix. And the states are New Jersey, Ohio, Oklahoma, Texas, Arizona, and Washington.
Okay, so it's not nationwide yet. So do you see, you know, is part of this that you're worried that it could go nationwide?
Yeah, as I mentioned, yeah, I do think that is going to. It's going to run through 2031, so it's 5 years, and depending on the results, it could expand. But I'm fairly certain that it's going to do that. So just remember for the listeners, right now it's just a pilot program. It's not nationwide yet. It's applying only to the 6 states that I mentioned, but it will impact the residents of those states that are on original Medicare. They are going to see the impacts of this pilot program.
Okay. So then the bigger question becomes why? Why is this happening? Why is Medicare running a pilot program? Medicare's been around forever. You would think that they've got it somewhat figured out. So why a test program? Why now?
Yeah, exactly. So, Centers for Medicare and Medicaid Services, known as CMS for short, they're targeting what they call, have been calling it for years and years and years, fraud, waste, and abuse. Okay, so breaking that down, fraud, billing Medicare, basically fraud in this context is billing Medicare for services that were not needed or not didn't even happen. Okay, so there's a lot of that unfortunately going on. Waste, which is defined here as overuse of expensive procedures that may not improve outcomes for people, right? But they're getting done and they're getting billed. And then the overall abuse, just using services in ways that don't follow Medicare guidelines. So with the exponential rise in costs of everything these days, as everybody knows about and is feeling on a day-to-day basis, it's impacting Medicare as well, and they are looking to clean this up, see if introducing this prior authorization can help clean this up.
Okay. Yeah, I know we did a podcast, probably a few months ago at this point related to the drug plans and some of the cost changes there to make it a little bit, I guess you could say, more fair across the board on prescription drugs. But some people end up paying a little bit more to try to make it a little bit fair. But anyways, the topic is that they're constantly looking at the cost. So it sounds like this is a cost measure as well. Is that right?
Yes, exactly. It's really about controlling costs. I believe at the heart of the matter, and also, but it's also about quality of care. So, Medicare has through this program identified certain procedures that are high cost, and they are many times overused, and have a history of questionable billing patterns by providers. So, I'm sure people out there are saying, well, why prior authorization, like you said, and why now? So, so basically, the premise here is what they're saying with the pilot program is instead of just having original Medicare pay first for things and then review it later, which is the standard procedure, standard operating procedure right now, what they're saying is let's put the brakes on. We're going to check before these procedures happen, right? And in doing that, we're hoping to prevent unnecessary procedures to be done. We're going to reduce improper payments out to providers and hopefully catch potential fraud earlier on in the process.
Okay, so from a top down view, Sean, it kind of seems like this is something that is to get rid of a lot of issues in the system, which are creating additional cost, and so it all sounds pretty good so far, but I think there's never a perfect solution to anything in most cases, especially when in government type of run policies. So, what's the trade off here? What are we missing?
Yeah, there is a trade-off exactly, and so the same system that is looking to stop and prevent fraud and waste and so forth can also, bog and slow things down, as we all know. Add, of course, administrative hurdles and hula hoops that people have to jump through and overcome, and create access issues, to providers and procedures if things are not done carefully. So. As we know that the overall goal and intention here of CMS and Medicare is to reduce the fraud, the waste, and the abuse that's going on within the system. They're focusing on high cost, high risk procedures. Um, And then, of course, the prior authorization is meant to prevent the problems before they happen. But as we know, this may also introduce to us delays and a lot of friction and things for patients and getting their continuity of care.
Right. Yeah. There's always, I think, when there's change in procedure, change in policy, change in a program, there's always going to be some element of there's a lot of there's a lot of nuance and a lot of everyone learning a new way of doing things, and that does create friction and issues in any environment. So it's
Yeah.
just one of
Yeah.
those things we have to deal with change. But hopefully, it does help out on the cost side in the big picture. But you've mentioned this term quite a bit throughout so far, which is prior authorization. Now, if you go to the doctor a lot, you probably know exactly what prior authorization is. But help us kind of understand, what is prior authorization in a simplistic manner, Sean?
Mhm. Absolutely. So most people, before they get into Medicare, being enrolled in employer group health insurance plans and being enrolled in ACA marketplace and health insurance plans, if they're self-employed or if they don't have employer-based coverage, they're probably used to prior authorization and may have heard that term specifically, but they've dealt with it most likely if they've had to have procedures and different things done throughout their lifetime. So basically, very simply, prior authorization means that your doctor or your medical provider uh, may need or will need to get approval before certain procedures are actually done. For you, things that they're going to recommend that you need to have done, they're going to need to get approval from the carrier, the health insurance carrier, or Medicare in this case, if they have to say, hey, we agree with you that this needs to be done, and they're going to pay for it. And if they don't get prior authorization, the provider or the doctor, and they go ahead and they do it anyway, the plan or Medicare may delay or deny payment altogether in the end. So it's really, today versus the new system, getting back to Medicare beneficiaries, today, people that are in original Medicare do not have to worry about prior authorization. Those on Medicare Advantage are dealing with prior authorization, but right now, original Medicare, not the case. However, this new system being piloted in these 6 states, they are going to have to be getting prior authorization for certain procedures beforehand, and moving forward. So that's kind of the gist here is that original Medicare beneficiaries are going to have to be working with prior authorization before procedures are done if they want Medicare to pay.
Okay, so yeah, let's speak to the ones that are original Medicare and have Medigap plans as well. Why does this matter for them? Let's talk to that demographic that's not on Advantage plans.
Yeah, so there's approximately 73 million people right now enrolled in Medicare, and there's about 35 million to 38 million people that are on original Medicare with Medigap plans. The rest are, in Medicare Advantage plans. So there's a significant amount of people out there that are set up on original Medicare, supplemented by a Medigap plan. And many of those people that do that structure, that coverage structure, have done it specifically to avoid network issues, provider and hospital network issues, getting access to providers and hospitals. Are they in the network? Are they out of the network? They're looking to avoid referrals from primary care to specialists if they need, advanced care or advanced procedures. And of course, avoiding prior authorization. They don't want to have to deal with that administrative red tape and so forth. However, this new pilot program, once again, that's why I wanted to talk about it today, is introducing a piece of managed care into original Medicare now. So people that are in that structure are gonna have to be aware of it and are gonna have to start dealing with it. So, but just know overall key takeaway here that even if you are in this cover structure with original Medicare to Medigap, you still are going to have your doctor, your freedom of doctors. You're going to have nationwide access to providers and hospitals, and you're still going to be able to keep your Medigap plans, and it's all still going to work the same. It's just that you need to know that some procedures that you may have recommended to you or you may need may require some extra steps with this prior authorization.
Okay, well that's helpful to know. So, I mean, if you're listening, you're probably and you're on Medigap. plans, and you're probably wondering how this is going to affect the healthcare services that you receive now. So, Sean, do we know yet what could be impacted as far as services to people that are affected by this?
There are, and there's not a laundry list, but there's about 17 to 20 things that are out there. So people, people can. I'm going to bring up just a few here because I know we've got some time. We just need to make sure we're not here for a long time with people on the podcast. But some things that are going to be impacted, that are common out there. Certain surgeries, such as orthopedic procedures, are going to be involved with this. There's something called cervical fusion, where providers surgically join two or more vertebrae together. That's done to treat severe pain that people are experiencing, or herniated discs or nerve compression issues. That's going to fall under this pilot program of prior authorization. Pain injections are going to fall under this. Epidural steroids, for one, is going to be impacted by it. Nerve stimulator procedures, such as a common one that's a test that's used to diagnose carpal tunnel syndrome in people. That's also going to fall under this, and then some advanced wound care and so forth. So these are some of the types of procedures and services that will be impacted by the prior authorization pilot program. But routine doctor visits, lab work that people need to get done, and most everyday care that they're needing is not going to be impacted at this point. So remember that this is targeting specific higher cost procedures, not everyday healthcare procedures.
Gotcha. So, we sit here in North Carolina, and this is a limited state trial that they're running. I think you said six different states.
Mhm.
So, the people listening, the bulk of our listeners are North Carolina, but we have people all over the country, actually all over the world at this point too, which is pretty cool to say. But I guess, Sean, for the ones here in North Carolina, it's not here yet, but help us kind of think through just real world impact to them if it was this trial was to be a success. And I don't even know what a success looks like in the eyes of the Medicare people, but what's the real world impact here?
Yeah, no, it's a great thought, a great ask. So, once again, I bring in this up because it is niche, but being involved with Medicare and healthcare for close to 25 years, I've seen a lot of things happen over this time, and I kind of know the writing on the wall, as they say, with a lot of things that are that are brought up or being talked about. And I do think that this program is gonna expand. So the challenges that people start to need to prepare for, with original Medicare, because remember, original Medicare is the primary health insurance, and a Medigap plan is a secondary payer backing up original Medicare. So you just need to make sure that you're preparing for possible delays for procedures that you may need. Uh, be patient and know that you're going to have more administrative paperwork involved with some procedures that are going to be falling under this. And also, we hate to talk about this, but denials, because remember that people that have been working with prior authorization, not everything gets approved by the plan per se, right? Just because the doctor recommended it and said, "Hey, you need to have this done," and then it goes to review with the health plan and the health and the team that's put together to review these requests. Not everything is approved, so there could be some denials. And obviously, you can appeal this, but that's more administrative, hula hoops and things you got to jump through. So, but overall, we just need to know also in a holistic approach that this is, and the intentions behind this is to reduce unnecessary procedures, to reduce the fraud and abuse, and protect Medicare and the Medicare funds and the whole system for everyone involved. So, but overall, just get ready to expect more administrative processes for certain procedures and delays that may happen, even if it's a short delay and or denials for things.
Yeah, I think just being proactive, especially if it was to make it in North Carolina, or if you're in one of those states that is piloting the program right now, being proactive, I think is going to be the biggest takeaway. And having someone in your corner like Sean that can help you kind of think through the right plan for you, and if Medigap is the right plan for you, kind of understanding what may be the new normal here going forward if it was to be approved broadly nationwide. as a program. So, Sean, I think this is fantastic to get out ahead of where sometimes we end up being very reactive. Oh, the policy changed, and so now we got to figure it out. But I think in this case, we're being rather proactive at getting it out there. And so for everyone listening, Sean in our office, I've said this at the beginning, but he is our Medicare and health insurance professional. And he works closely. He's got a very nice consultative process as far as helping people think through what's going to be the right plan for them pre-Medicare or walking into Medicare, and thinking through the costs, thinking through the types of prescriptions that you already take, thinking through the types of plans that work well for ones that want to travel a lot in retirement versus ones that are more regional in their travel. And so what I would say to anyone that if this is, especially if you're in one of those states and you want to understand more, but if you don't understand any facet of Medicare, or you're walking into it and you want more guidance, a big reason as to why we brought Sean into our program at Peace of Mind Wealth Management is we wanted him to serve as a value add to clients, as a consultative approach rather than pushing product. Sean doesn't do that. He doesn't have to, the way that we've got him set up here. So I think that's a huge benefit. And also the feedback that we do get from clients around the conversations. Sean's a prior educator before he got into Medicare, so he teaches first, and then you make decisions together. And I think that's what true collaboration looks like. On top of that, Sean does a monthly Medicare webinar for those that are getting close to Medicare and they want to start learning more about it. We're happy to provide you access to that as well. So I just want to say again, Sean, thanks for hopping on with me and taking some time to explain what is niche right now, but could become a much bigger conversation down the road. And so I think it's good that we're being proactive here today.
Yeah, no, I really appreciate the invite, and it's always great to be on the podcast. Talking about Medicare. Do love Medicare a lot. I know you do too, Mers. And so I'm always eager and happy to be involved and to help people, with their Medicare and their healthcare decisions and their choices.
Yeah, and we're glad to have you. So if you do have any interest of striking up a conversation with Sean, a handful of ways to do that. You can go to our website, and there's a form that you can fill out, and you just put down that I'd like to speak with Sean around Medicare. Or if you want to hop on to one of his monthly webinars, we're happy to give you access to that as well. Easiest thing that you can do is just reach out to us at our office, 919-787-8866. And that'll get you to someone who can get you to Sean, or can get you to the invites for our monthly Medicare webinars that Sean does. But as always, thank you all for being here. Thanks for taking some time to listen on your commute or on your drive home or just while you're out for a walk. We do appreciate it. And if you have any questions that you want answered on this podcast, just let us know. We're happy to. We love taking feedback, and we love following up on conversations through this nice ability that we have to kind of share to the masses. So, but as always, thanks for listening, and we'll talk to you again next Monday.
If you would like to find more information about Peace of Mind Wealth Management, we invite you to visit our website at pomwealth.net. If you go to the contact page and contact us, we'll send you a free copy of our book, The Peace of Mind Pathway. It lays out our process from beginning to end. Please visit our website.
For more retirement tips, check out these videos. Also, if you find them valuable, please subscribe to our YouTube channel and give us a like.